Hello and welcome to the sixth edition of the Global Conference on Addiction Medicine, Behavioral Health, and Psychiatry. Understanding Glean from Human Genome Project and Worldwide Gene Association studies have ushered in a new field of medicine, which greatly affects our industry. Allow me to introduce psychiatric genomics. Based upon exponential global research contributions, it's now understood that neurogenetic, neurobiological, and epigenetic causal influences manifest in addiction behavioral symptoms. Let me repeat this important foundational tenet of the genomic era. Addictions and other mental health disorders are symptoms of underlying neurobiological syndromes. This presentation is dedicated to those with clusters of mental illness, and it's called A Life Uncommon. The L Foundation, incorporated in 1995 in Dallas, Texas, had an original mission statement of stopping the generational cycle of addiction. Prevention for the next generation is still our primary goal. However, we are also focused upon family genomics, helping addicts with mental health disorder comorbidity receive genomic interventions for reward deficiency syndrome. In the year 2000, the L Foundation created the Award of Excellence to recognize novel contributions and innovations which are changing the addiction recovery industry, enlarging perspective beyond the limitations of existing models, and raising the bar above the level of the 1950s Minnesota model. The first Award of Excellence was presented to Dr. Deborah Mash, neuroscientist, professor of neurology, chairman of the Brain Endowment Bank at Miller School of Medicine, University of Miami, at her St. Kitts Healing Visions research facility for novel contribution through discovery of both the cocaethylene molecule and the noribogaine metabolite, and advancement in opioid detoxification using ibogaine. Over the decades, we have spotlighted the work of scientists, doctors, treatment centers, individual and institutional entities to showcase resources and inspire hope for those still suffering. In the early 2010s, we began contributing research review analysis of peer-reviewed addiction studies and began following the works of progressive scientists who were inventing translational medicine to address underlying neurogenetic and neurobiological causal influences. We wish to raise awareness of new innovations from the world of science in the genomic era of addiction medicine to offer hope to transgenerational families who have not found remedy in traditional treatment. Science has many superstars, pioneers, and trailblazers. Dr. Mark Gold outshines even the best. He's a trailblazer, a pioneer in addiction research. His research on the brain reward pathway is revolutionary in that he was able to identify how drugs like cocaine, opioids, and nicotine literally hijack the brain's reward circuits. He contributed great understanding to the role of dopamine and norepinephrine in addiction. He discovered cocaine's mechanisms of action, how it affects the pleasure pathways, and dopamine's role in intensifying cocaine's effect. This understanding helped open doors for improved treatment protocols and strategies to treat cocaine addiction. Likewise, he has contributed innovative treatments for opioid use, using both opioid agonist and antagonist. His research has informed of better approaches to quell the opioid epidemic. Dr. Gold applied the brain disease model of addiction to nicotine use disorder and smoking. This model looks at smoking as more than a bad habit, but as an addiction driven by changes in brain neurochemistry. His work led to new treatments such as nicotine replacement therapies. Dr. Gold's work has informed clinical practice, government policy, and helped re-educate the public as to the neurogenetic and neurobiological nature of addiction as a neurobiological brain disease. He has inspired improved care and reduced stigma. He has helped ease the shame of patients who were judged as having moral failing, lack of willpower, personality disorder, and or behavioral issues. He has been an advocate for access to early intervention, focusing on the neurobiological underpinnings and evidence-based treatment to induce dopamine homeostasis. He has trailblazed genomic interventions, created new practice training programs with accreditation for standards of care. Dr. Gold's literary and research contributions are extensive. He has authored hundreds of research papers, articles, books, and as editor of Psychology Today, he contributes informed blogs to help the public and the practitioner. As a professor, he has mentored generations of students, researchers, and clinicians. This list includes inspiring Dr. Nora Valkow, who currently serves as director of the National Institute on Drug Abuse, NIDA, to evaluate the dopamine homeostasis theory when she was a resident in psychiatry at New York University. Many in the layperson practitioner world of traditional treatment remain uninformed of the enormity of change in perspective, which has come from the completion of the Human Genome Project and gene-wide association studies. New translational models have been created. Genetic and epigenetic biomarkers have been discovered. New understanding supports Dr. Gold's assertion that dopamine depletion and neurobiological syndromes such as RDS, affecting the brain's reward system, are the true issues which need neuroscientific intervention. Early in his career, he discovered that cocaine withdrawal is not solely psychological, but that it has physiological aspects, epigenetic alterations affecting dopamine availability on molecular and cellular levels. The 1985 article titled New Concepts in Cocaine Addiction, the Dopamine Depletion Hypothesis, and his many follow-up articles reveal that cocaine withdrawal is complicated and needing medical assistance. How is it that research evidence has not led to a change or an update of admittance criteria for detoxification facilities? Recently, a woman from West Palm Beach died within a matter of hours after being denied admittance to a detox facility. The administrative criteria for detox admittance is not up to date with current genomic perspective, nor is it in alignment with new scientific evidence. In fact, in this case, it appears to be 40 years behind science. It's said that it takes 100 years for scientific advancements to trickle down to public knowledge. We need to speed that up. Update 12-step treatment protocols with neuroscientific interventions. Those working on the front line must operate within the guidelines and limitations of their corporate administration bodies. How do we speed the delivery of novel genomic treatment applications to the front line, to the forefront where therapists treat patients? Continuing education credits is one way. Another brilliant superstar in the research world in the field of neuroscience is Dr. Panayotis Thanos, a professor who has contributed in large perspective of behavioral neuropharmacology and neuroimaging of dopaminergic pathways. He's a senior research scientist and director of the Behavioral Neuropharmacology and Neuroimaging Laboratory on Addiction at the Clinical Research Institute at Jacobs School of Medicine and Behavioral Sciences at the University at Buffalo. In addition to his extensive research, including almost 250 peer-reviewed articles, he's literally teaching the next generation of neuroscientists and doctors of neuropharmacology. His neuroimaging contributions have been extremely helpful in providing visual testimony to dopamine neurotransmission, as well as mapping the brain's functional connectivity in response to drugs of abuse, genetics, and environment. He has mentored hundreds of students and young scientists, many of which are today practicing physicians and faculty in academia. Eventually, these contributions in academia and clinical practice will trickle down to the practitioner layperson world. But in the meantime, hundreds of thousands die each year. The entire practitioner world, educated in the traditional treatment era, needs to be educated in the RDS paradigm and psychiatric and psychological genomics. Dr. Thanos' focus on understanding the genetic and psychosocial risk factors, including environmental, are critical in helping better understand and serve patients. Dr. Thanos' molecular psychiatry research has also helped provide data to support the concept of RDS and how this can be used as an adjunct to traditional approaches. Specifically, Dr. Panayotis Thanos' contributions have led to new neuroscientific applications for patients with RDS manifesting as addictive endotypes. His work in association with other global scientists has increased awareness of the real phenotype, RDS, bringing attention to the fact that traditional treatment addresses symptomatic addiction behaviors rather than biobehavioral causal influences. Most recently, Dr. Thanos' lab has published research on the utilization of exercise precision dosing as an additional adjunct tool in attenuating and preventing substance use disorder, and it's considered one of the leaders in exercise neuroscience, science, and addiction. Finally, Dr. Thanos' lab is presently studying the behavioral, neurochemical, and brain connectivity consequences of prenatal nicotine and cannabis exposure on the offspring. The goal is to provide a greater insight into the impact of this prenatal exposure on the risk for psychiatric disorders. The Yale Foundation celebrated 30 years of service on January 14th of this year, 2025. The Yale Foundation Research Institute's 100 series of family genomics continues, and the 200 series is set to begin in 2025. We have a voice and a platform, and we wish to shine a media spotlight on these two incredible scientists who are changing the recovery landscape. We wish to say thank you on behalf of ourselves, those still suffering, those who died in their disease, and on behalf of the recovering world. Today, the Yale Foundation re-announces 2025 awards honoring Dr. Mark Gold with a Lifetime Achievement Award in Neuroscience and Dr. Panayiotis Thanos with the 2025 Award for Excellence in Behavioral Neuropharmacology and Neuroimaging. Thank you for your excellence and for your service. This presentation provides a review of L Foundation 100 series in family genomics and an update on Case Study 101 on her personal progress utilizing a genomic treatment plan based upon the reward deficiency syndrome solution system. Genomic era interventions are based upon neuroscience to achieve dopamine homeostasis. The supervisory committee is made up of some of the world's most knowledgeable reward deficiency syndrome consortium scientists. Many theories have been submitted for peer review between the 1950s and 2025. However, for simplicity's sake, I've listed the three most prominent to illustrate my point. That until the creation of the new neurodevelopmental model in 2017, individual theories were incomplete, focused upon aspects associated with various divisions of psychology, associated with partial etiology or causal influence. In the 1950s, Hazelton monetized the pre-existing 12-step model, rebranding it as the Minnesota model. This model misidentifies causal influence and does not consider genetic variances which had not been discovered yet. In the 1980s, government-funded research examined other variables of recovery success beyond abstinence to gain a larger understanding of treatment benefit in various realms of human relationships. In the year 2000, Kenneth Bloom published the biogenetic model, which at that time was the most progressive, on point, and relevant understanding of the neuroscience phenomenon. Around 2010, NIDA Director Nora Valkow announced funding for worldwide association studies with millions of participants to verify the correlation of genetic variances and mental health disorders. The resulting expanded therapeutic model recognizes causal influence of genetics, epigenetics, and neurological syndromes. It is also understood that the real phenotype is reward deficiency syndrome, and addiction is one symptom. The practitioner arm of psychology has been trained in the early traditional treatment methods. The research arm of psychology is clearly investigating the genomic era of precision addiction medicine. The gap between yesterday's practice and today's genomic applications spans approximately 50 to 80 years. The L Foundation 100 Series Family Genomics Case Series includes to date Case Study 101, who is our proband, Case Study 102, which compares biological sisters, Case Study 103, which investigates 3 generations of family genomics from grandmother, daughters, and their children. Case Study 104 is a longitudinal prevention study in the 4th generation, the 2 grandsons of the proband. Study 105 is still open for participation inclusion, and it involves extended family genomics with a sample greater than 50, and it is still in development. 106 involves the probe and her daughter overcoming generational trauma in development. The reward deficiency syndrome solution system used in this study may serve as a tutorial for continuing education to introduce applications from psychiatric and psychological genomics. The reward deficiency syndrome treatment plan includes the following. The bullet points to remember are, number one, that we use genetic addiction risk score, or the GARS screening for RDS, behavioral expression, and addiction risk score. Number two, a brain checkup through multifaceted brain imaging to assess trauma from brain injury and identify targets for intervention. Number three, we begin a nutraceutical amino acid therapy in AAT for brain health. This is the KB220Z formula, and it adds nutrients to the brain. Number four, we evaluate the appropriateness of dopamine agonist therapy and other pharmacogenomic intervention therapy for short-term neurological stabilization for mental health disorder diagnoses. Number five, RDS solution-focused brief intervention therapy is a psychological education of the RDS paradigm, and it focuses upon natural means to achieve dopamine homeostasis. We also use the RDS SOS tool. Number six, reward deficiency syndrome solution and precision addiction management, or PAM, protocol adherence is evaluated. Number seven, the patient begins integrative awareness therapy. Number eight, the client will initiate wellness practices for mind, body, and spirit, like exercise, nutrition, meditation, and other spiritual enhancements. Number nine, neurotherapy such as neurofeedback, electromagnetic frequency therapies to balance brain frequencies and offset EEG imbalances are inserted. Number 10, we utilize psychology in all her divisions, such as humanistic, transpersonal, existential, positive, integral, for thriving, in addition to cognitive behavioral. Number 11, the patient or client will evaluate sober living communities, social support from spiritual wellness, and 12-step communities. And number 12, the patient takes the lead role in self-management and treatment planning for thriving, and basically practices maintaining dopamine homeostasis and regaining it after it is lost. Upon experiencing dopamine homeostasis for the first time, the most common participant response is, "This is bliss," in that they're no longer suffering. Achieving dopamine homeostasis is the first step in teaching patients to achieve, maintain, and regain neurological balance. The program is in year 5 right now. The first 4 years were spent doing genetic screening, doing a neurological analysis, and working to get the proper pharmaceutical intervention at the right dosage. And we had to reevaluate traditional methods. Some of the medicines were counteracting other medicines and had the potential to cause TIAs. And it was complicated, but the first success was in any area that in which dopamine deficiency was a cause, like addictional behavior, ADHD. So those were the first two things that she successfully conquered. We found out that her situation on the dopaminergic disruption was more complicated because she also had dopamine surfeit, or an increased metabolism. So in some areas of the brain, too little dopamine, in other areas, too much. So treating that is more difficult because the medications counteract one another. So we used more nutraceutical and more awareness therapy in conquering that. And over the years, she did a great job with learning of how to maintain and how to elongate the pause between the progressive cognitive chronic cycle or pattern that leads to dementia. So in dealing with addictions, ADHD, bipolar, we found a great deal of success. And she was able to experience dopamine homeostasis. And it was so wonderful that she thought she was well. She didn't need the medicines anymore and went off them and then decided to go back on them. And she's regulating this and helping get the micro dosage that's necessary because we don't want to over-medicate. Instead of hundreds of milligrams, we're generally looking at between 0.25 milligrams or up to 10 milligrams. So that takes us up to year 4, which this article was published in, bringing everybody up to date. Now, year 5 is almost over, and it's been extremely tough. Excuse me. Because she was stable enough and well enough to address the most complex of her issues. While she has the genetics for PTSD, she wasn't able to clear them and experienced psychiatric fracture, which led to multiplicity, dissociative skill sets. And that is extremely challenging for anyone to come to terms with, to realize they have it, and to start healing themselves. And healing is an inside job. So she's aware that she has a committee within her. And she's working her way through it. So we're extremely proud of the progress that's made in year 5. And this is a 20-year study, so we'll keep you updated. Treatment for dopamine disruption over the lifespan is a frontline modality. Primary care physicians should be looking for symptoms as displayed over the lifespan in order to treat the underlying neurobiological challenges. RDS can be predicted and prevented. If we're going to stop a generational cycle, we must know what we're dealing with, the true phenotype, and address the causal influences, as opposed to underlying mental health disorders and addictions, which are actually endotypes or symptoms, the result of not treating the underlying neurobiological syndrome, such as reward deficiency syndrome. From early brain development to dementia, RDS affects patients over the entirety of life and manifests differently in individuals within the same family. This is generational. Genetic screening identifies variances which can reveal a proclivity for neurobiological syndromes which manifest as mental health disorders. RDS consortium scientists can predict outcome and also help prevent manifestation of with an early intervention. As the disease progresses over the lifespan, the devastation from dopamine dysfunction in the forms of deficiency or surfeit create epigenetic insults which interfere with pharmacogenomic and nutraceutical interventions. So just to go back to the proband in this case, we're also now working on Parkinson's prevention because she is entering the elderly or late stages of life. This slide and the next slide list the publications that have been peer-reviewed and published regarding the L Foundation 100 series. So I'll give you a moment just to look down and scan. We start with the most recent, going back to the earliest. This is in case you might want to dive deep. We're about to receive our IRB approval for the 200 series, expected this week. And this is just some recruitment information in case you might want to ask some questions about whether or not this study is right for you. We're so proud to have been serving humanity for 30 years, since January 14th, 1995. On behalf of the L Foundation, L Research, and L Resource, I thank you for your time and for listening. And if you want to get in touch with me, we're a private nonprofit, so we're not easy to find, but here's my contact information. Number, email, and you can look up ellresource.com, ELLE resource.com. Thank you. Hope you've had a great conference.